Hello, I'm Dr. Joe of the drjoe.com. Now, do you need a good amount of sleep to protect your heart and your blood vessels? And if so, how many hours of sleep do you actually need to protect your cardiovascular health? We're going to be exploring that with the aid of a study that was published recently. And along with that, I got some essential tips for you that will help you get a good night rest. That's what's coming up next, so stay tuned. I'll see you after the channel intro.
Now, for today's 2020 idea to better health, please welcome on stage Dr. Joe.
Hello, I'm Dr. Joe of the drjoe.com. Welcome back. Now, we're going to be talking about sleep and heart disease. What's the relationship between sleep and heart disease? Now, if you're one of those people who normally sleeps for 3 to 4 hours a night and you're happy with it, you can function with it, you don't have any issues at all, is it possible that you're doing your long-term cardiovascular health some damage? It doesn't really matter that you sleep for just 3 to 4 hours a night. Now, we're going to be exploring those issues in this video presentation. And here's something else. A lot of what I'm going to say here will apply to sleep apnea, even though this presentation is not about sleep apnea. And one more thing you need to know, and this is important, the heart is not the only organ that is usually affected by consequences of poor sleep. Other blood vessels, for instance, the carotid artery, can also get affected. And carotid artery disease can just be as bad and debilitating as coronary artery disease. So we're going to be exploring some of these issues with the aid of a study that was published recently. So let's move on to the study now, shall we? This is the study I'm referring to. It was published in the Journal of the American College of Cardiology with the title Association of Sleep Duration and Quality with Subclinical Atherosclerosis. What is atherosclerosis? Atherosclerosis is a condition that could be clinical or subclinical, as in this case, where the blood vessel would have developed plaques, usually fatty plaques, and over time, because it's a progressive condition, over time, especially if the risk factors are still present, the blood vessel will become narrower and narrower, and that can lead to heart attacks and strokes in future. So what did the authors actually do? What they did was they recruited 3,974 participants in Spain, and they used a 7-day actigraphic recording. And an actigraph is actually a device with which you can monitor rest and activity cycle. So over a 7-day period, they performed the actigraphic recording, and with the help of that, they were able to divide the participants into 4 subgroups. What are these groups? Well, the first group were those who slept for less than 6 hours, and then second group were those who slept for 6 to 7 hours, third group being those who slept for 7 to 8 hours, and a fourth group were those who slept for more than 8 hours. And what did they do? They monitored the health of the blood vessels of these individuals using 3D ultrasound scan as well as CT scans. And they looked at the coronary vessels. The coronary vessels are the vessels that actually supply blood to your heart muscle, and the carotid artery was another vessel that they studied. The carotid artery is the vessel that actually supplies blood to your brain, and the femoral is the artery that supplies blood to your legs. So they monitor the health of those vessels over time. And what did they find? They found that in actual fact, those who slept for less than 6 hours actually had a 27% risk of developing atherosclerosis, i.e. plaque formation in those blood vessels. And there was something else they found, and this is quite interesting. Those who had fragmented sleep, poor quality sleep, actually had a worse outcome. They had a 34% chance of developing plaques compared to those who had good quality sleep. So there we are. This study is actually telling us that sleeping for short durations as well as having poor quality sleep, these factors actually independently increase your risk of developing plaques in your blood vessels. And if you want healthy blood vessels for the future, then it sort of makes sense for you to maintain a very decent healthy sleep habits because you need this for the prevention of cardiovascular disease. So what are the main points of this study? Well, this study tells us that less than 6 hours sleep a night is bad for your heart and your blood vessels. It also tells us that fragmented sleep is just as bad for your heart and blood vessels as a short duration of sleep. The study authors also found that there was a strong association between caffeine use and short and disrupted sleep. They also found that there was a strong association between the use of alcohol and short and poor quality sleep. Indeed, I've done a video on the relationship between alcohol and sleep. The link should be up there now. When you finish watching this video, you go ahead and watch that video and you will uncover how alcohol actually affects your sleep. So, what's the main risk? Well, the risk of short and or fragmented sleep is plaque formation in your arteries. Now, the problem is that if you continue to have bad sleeping habits, well, the risk of plaque formation is progressive. That means you could be storing problems for the future. And what are these problems? Well, I've already talked about the plaque buildup. Now, plaque buildup is almost guaranteed to negatively affect your cardiovascular health. So you'll be talking about things like strokes if the arteries supplying blood to your brain are affected, heart attacks if your coronary arteries are affected, and then there's a condition we call intermittent claudication. This is a condition where you develop leg pain during exercise. Now, intermittent claudication actually occurs when the arteries supplying blood to your legs are affected. Now, you can also have problems with dementia, and in dementia group, you also have the Alzheimer's disease subgroup. So here we're referring to vascular dementia. These are some of the problems that can actually occur if you continue to have bad sleeping habits where you have poor quality sleep or insufficient sleep. Then it begs the question, what's the required sleep duration for optimum cardiovascular health? Well, as far as this study is concerned, it's not the first study to say this, but this study confirms that 7 to 8 hours sleep duration is what we need every night for us to maintain optimum cardiovascular health. Now, having identified the problem, I need to come up with a solution. How do you get a good night's sleep? Well, I could offer you several tips here, but I'm just going to limit us to 4 tips here because I want to keep this video short. And the tips I'm going to offer here are very simple, as you soon find out. So, what are these tips? Well, the first tip is you should get into a routine. A routine as to when to go to bed, when to get up in the morning. And you should also have a winding down routine. Now, as simplistic as this tip sounds, it actually works. And why does it work? Well, it forces your body clock to fall in line. Our body likes routine, and once you get into a routine, it will just fall in line and you get a decent night rest. Second tip is you should reduce or shut off blue light exposure at least 1 hour before bedtime. By blue light exposure, I'm referring to things like smartphones, laptops, tablets. All of these devices actually emit blue light, and blue light has been shown conclusively to actually suppress melatonin production. And melatonin is your sleep hormone. You need your melatonin to actually get a good night's sleep. So shut off blue light exposure at least 1 hour before bedtime. Ideally 2 hours, but if you cannot help it, 1 hour. So that's tip number 2. Tip number 3 is an offshoot of the second tip. You should keep your bedroom dark. Well, our body actually likes darkness, at least in terms of sleep anyway. And darkness signals melatonin production. And like I said before, the more melatonin you have, the better your sleep is going to be. So darkness promotes melatonin production. More melatonin means better sleep. So keep your bedrooms dark. Tip number 4 is that you should eat foods at night that will make you sleep better. There's a long list of foods that you can actually eat that will make you get better sleep at night. And indeed, I've done a video on this subject. The link should be up there now. When you finish watching this video, you go ahead and watch that video. You see the list of foods that I've talked about that will help you get better sleep at night. So that's tip number 4. Eat foods that will make you sleep better. Now, I've got a question for you. If you're new to this channel, let me ask you this. Have you subscribed? If you haven't subscribed, well, you should subscribe. Well, the button is right there in the bottom right corner. It helps for you to subscribe. Why is this? Well, you'll get notified of future videos that I make. If you've enjoyed this video, there's more where this video came from. So you should subscribe. That way you actually get notified of future videos that I make. And if you've been coming to this channel and you still haven't subscribed, please do subscribe. The subscription button is there, as you can see there in the bottom right corner. Now, if you've enjoyed this video as much as I have, please do share it with a friend or family member. Just share the love, like I say. That way, your friend or family member will become informed about what I've just talked about in this video. Now, I'm going to end this video. If you liked what you've seen here, please give this video a thumbs up. And show your likeness. Just hit the like button. YouTube likes that when you give me a like. I think that's about it as far as this video is concerned. If you've got anything to say, you can say it in the comment section. And that's about it. Please do subscribe, like the video, and say whatever you want to say in the comment section. Until next time, well, this is Dr. Joe signing out.